Thank you very much, Mr. Kayudu, for your kind words. Good morning to all. I would like to thank Mr. Siriapoyo for inviting me to speak to you about social skill groups in autism, bridging the social functioning and competence. A speech language pathologist working in private practice for the past 30 years and a member of the developmental pediatrics unit at the Aglaia Kyriakou Children's Hospital for nearly as long. Working with children in the autism spectrum has always been challenging, intriguing, and very, very rewarding. Sorry about that. We had problems with our being social and interacting with others and making friends seems so easy and enjoyable for most people. But for people with autism spectrum disorder, it can be very stressful and challenging. Social skills are the rules, the customs, and the abilities that guide our interactions with other people and the world around us, affecting thus our interpersonal relationship and thus our social functioning and competence. Social skills is the ability to effectively interact and communicate with others through our words, our actions, and our body language. For people with autism, it can be so much harder to learn and build up these skills. They often have the desire to interact with others, but do not have the skills to engage appropriately, or it might be a very overwhelming process for them. The challenges that these individuals with ASD encounter include difficulties in their receptive and expressive use of nonverbal social cues, such as our facial expressions, eye contact, gestures, and body language. They find it very difficult to understand other people's perspectives, what they're thinking, what their intentions are, what their interests are, and how they feel. Engaging in social and emotional reciprocity is a big challenge for them. And other difficulties include restrictive and repetitive patterns of behavior, fixated interests, and difficulties in adjusting in routines to changes of their routine. Challenges in social communication have a very significant negative impact on children and their families. Many parents cite that their child's social and communication impairment is one of their greatest sources of stress during developmental years. We see that there's strained parent and sibling relationship. These children have limited peer relationships, and those relationships that they do form can be poor. Social interaction is very anxiety-provoking for them because it is so unpredictable. They develop low self-esteem, they have increased rates of bullying, and the lack of friendship and positive peer relationship leads these children to low academic performance, and in long term, in adulthood, not being able to have social skills may hinder career advancement. Having all these challenges, we realize that it is very, very important for intervention, for the need for early intervention, recognizing and identifying the signs of autism in early childhood is really fundamental. And so is early intervention. The earlier we start, Mrs. Staffel also stressed out that point. Early intervention is of foremost importance in order to address the social communication interaction difficulties these children face, which consequently will improve their quality of life. We start off with individual therapy, especially with younger children, and individual therapy on a one-to-one base in order to facilitate acquisition skills, especially language skills, and other times simultaneously or gradually, these children will attend a group setting. The group allows individuals to learn and develop their social skills in a comfortable setting that they've got less pressure, it's organized, it's structured, there's a lot of fun among peers, and with support to be able to generalize and maintain the skills that they've achieved into natural settings and the community. Selection of the group members is affected largely by the assessment process. That is through formal standardized assessment or informal observational assessment. Both are very, very important in order to build and to identify each child's strengths, needs, and difficulties, and then place them into an appropriate group setting. The age plays a big role. We find that we normally have multiple groups at different ages, ranging from the age of 3 years old to young adulthood, with a tight age band of about 2 years in earlier years, according to specific age and developmental level. When they get to adolescence and adulthood, the years go to 3 to 4, the age band. Who facilitates the group? Normally the group is run by either a speech language pathologist or a psychologist, an applied behavior therapist, occupational therapist. Normally we find that we've got 2 group facilitators per group, depending of course on the size of the group. The general aims vary significantly based on the age and the skill of the participants. Some of the most common general aims include for children, the younger children, verbal and non-verbal communication, playing skills, personal space, social engagement, social thinking. And as the children get older in adolescence, we've got skills, problem-solving skills, compromising, dealing with conflict. And as they get even older, we manage emotions, workplace behavior. Of course, the main aim of the social teams is to have lots of fun and for children to feel comfortable in the setting. The general aims of the group are essential in order, they need to be very flexible in order to accommodate the needs of all the group members. Then each participant has a more specific individual target. Individual targets are then reviewed and recorded, systematically recorded, to monitor ongoing process or the need for the process or the need for modification as different issues arise in those targets. Participants, which is very important, are then guided to integrate their skills, the skills that they learned in the sessions into their daily activities. Keeping always in mind the core difficulty of children with ASD to generalize skills is our most ultimate treatment goal, because we need to generalize and generalize the social functioning and maintain them across settings and across different settings and different people. Over the years, or should I say over the decades, we could see that learned skills that were comfortably used in the therapy setting and community setting by therapists, of course, in our therapist presence, were not sufficiently implemented at home, in the community, and especially at school. Of course, we weren't the only ones to see that, and we are very grateful for the ongoing studies that come to support a more holistic and integrated transdisciplinary model, which is composed of the social skills group professionals, parents, and teachers, in order to facilitate generalization of skills across all settings. Parent counseling, parent groups aimed firstly at counseling the parents and teaching them about socialization and development, training them in prompting methods, training them in social coaching strategies in order for the parents to be able to facilitate social engagement outside of the clinical setting. And they do this by arranging and maintaining some peer gatherings such as play dates. What is very important is that parent involvement in their child's intervention reduced their own levels of anxiety, first of all, facilitated acquired goals in social skills and peer engagement across developmental stages. That, in the long run, social skills were generalized and retained over time. Teachers training.
Dr. Tzorva, we have only, a minute for you.
I'm finishing off. This is my last slide. Thank you. In teachers training, we wanted to support and collaborate with the teachers and shadow teachers at school in order to carry over these skills in the school setting. Teachers were trained to facilitate classroom and playground management. Teachers, however, we found are also very important to teach the neurotypical peers how to be good friends to someone with autism. I would like to take this opportunity to thank everyone for listening and to thank all our children that we've got in our center and all the kids, all the children and adults and adolescents and young adults that have been part of our team and has helped us grow as therapists. Thank you very much for listening.